Let's look at the risk factors for obstructive sleep apnea. Now, these include upper airway anatomy. If you have a very small airway, there's an anterior-posterior. On inspection, there doesn't seem really a lot of room behind the tongue. Or there's an elongated soft palate. We have enlarged tonsils, adenoids, particularly you might notice these in children. TNA, as it's referred to by your ENT. And then we have endocrine and abnormalities, genetic diseases, perhaps as well. So, upper airway anatomy, again, come back to that. It could be that we have a severe class 2, or macroglossia. There are a number of issues to look out for that actually crowd the airway. Let's move on then to alcohol and sedative use. Kind of self-explanatory, that one, isn't it? If you have a great consumption of alcohol, everyone that snores perhaps, if you don't snore and you drink alcohol, you're likely to snore. If you do snore routinely and you drink alcohol, you're likely to have obstructive sleep apnea events. If you have OSA and you drink alcohol, you're likely to have worsened obstructive sleep apnea. Similarly with sedatives. Smoking, well, we know that smoking inflames tissue, makes things angry, increases your tissue angry, and edema. Then you'll also find that you have the congestion that goes with that, and the irritation of the mucosa. So all of these things narrow the airway and make you more prone to snore. Unfortunately, guys, being male is a risk factor for obstructive sleep apnea. We've looked at that earlier on about snoring. That do men snore more than women? Well, yes, unfortunately they do, but it is also a risk factor for obstructive sleep apnea. So it's the way that we deposit weight, and perhaps the build that we have, shorter, wider necks, perhaps heavy set jaw. But yeah, unfortunately, just being male. It's been suggested that estrogen and progesterone levels in premenopausal women protect them from OSA. But certainly we see that women catch up rapidly on the snoring scale after menopause. Being overweight. Now I'll touch on that in a moment, but about the relationship between weight and OSA. Obesity, and then obesity hypoventilation syndrome, essentially where the individual is so large it actually represses their ability to breathe. They're so large that they cannot expand their chest against their own weight and take a decent breath. And then there are skeletal factors. I touched on that earlier on, severe class 2 perhaps, but other sort of skeletal abnormalities. And then sleep position, gravity. Sleeping on your back is not good. It means that everything falls backwards and narrows the airway. So the lesson is get off your back. Okay, let's move on. I touched on this a moment ago, OSA and body weight. Well, there you go. You can see that the apnea index rises significantly when you have, shall we say, a larger than ideal body weight. The graph is self-explanatory. Okay, so let's look at the two hormones that you may or may not be familiar with, and how they relate to obesity and sleep deprivation, how they relate. So leptin and ghrelin are two hormones that you should be aware of. These hormones are affected by sleep disturbances. So if you can't breathe properly, then you're likely to have a disrupted appetite, and you will gain weight. So let's talk about it. Leptin is released by fat cells to tell the brain that fat stores are adequate. So the fat cells actually say, hey, we have enough. Well, ghrelin is released by the stomach and when you're hungry. So if you have poor sleep, it delays, your leptin levels are low and your ghrelin levels are high. So both would encourage you to eat more. So I'll repeat that. So leptin is released by the fat cells to tell the brain that fat stores are adequate. and if you have bad sleep, leptin is low. And ghrelin tells you you're hungry, and if you have bad sleep, ghrelin levels are high. So it's very difficult to actually feel full when you have poor sleep. You know, we get the munchies perhaps.